Welcome to the My City, My Health podcast, where we are having real conversations about public health, community wellness, and the work being done to create healthier communities. Now, each episode, we sit down with thought leaders, change makers, and advocates to explore solutions that are making a difference. Now, don't forget, My City, My Health is hitting the road. Join us for our next conference on April 18th at the University of Iowa. Students get in free. You can register and find out more at www.mycity.health. Now let's get into the conversation.
All right. Thank you for listening to the My City, My Health podcast. I'm your host, Laurna Evans Lindsay, and today I'm excited for our conversation with our next guest. So I will let you introduce yourself.
Yeah, thank you. My name is Jahnavi. I'm originally from India. I was brought up in Mumbai, did my bachelor's and master's from India, and worked briefly as a psychologist there, and then came here to the US in August of 2021 to pursue my PhD in counseling psychology.
That's wonderful. Thank you for sharing that. So it is interesting that you come from India and then you come to the States to kind of pursue the same career. So could you share a bit about your journey as a counseling psychologist and what made you decide to pursue your PhD here in the States?
Yeah, thanks. I mean, my start in psychology, most of the research that is produced in psychology is produced in the US. And so even though I got my education in India, majority of the education in psychology and the studies that we studied about were in the US. And growing up, I wanted to be a psychologist to make a difference in my community. I wanted to learn and apply psychology. And as I got farther and farther in my education, I realized that I just don't want to learn and apply. I also want to contribute to the field. And so I realized that US would be the best place for me to bring in my unique experiences from India, also learn the things and the way things are done systemically and also culturally in the US, and bring a sort of an amalgamation of the two to create something new. And that's why I came in to the US to pursue my PhD.
Lovely. So I guess in my background research of what I know of you and your work, you emphasize cultural sensitivity a lot and inclusive mental access. Could you elaborate on what that means and why it's critical in healthcare today?
Yeah, thanks. I think it's true for both, even when I was working in India and here. In India, a lot of the research that we read about was based on the US populations. And so when we're working with Indian communities, like if I'm working with women in rural India, there are things that don't translate directly. And then when I came to the US and started working in Iowa, I also got an opportunity to work with a lot of people from Iowa and realized that the research may not necessarily be representative. A lot of our research is done on college students, so we have a certain type of population that may not necessarily be representative of the people that we work with. And so cultural sensitivity would include understanding the people you serve, and working with them from their perspective and their lens, which may not necessarily be represented in what the textbook says. And so I think it includes welcoming the other person to bring themselves in rather than having this manualized or a fixed form of treatment that you try to fit to everyone. Because in that case, even though no matter how hard our state or the government tries to increase access to people, it still doesn't end up reaching them if they don't feel welcomed in the space or if they don't feel heard. And so cultural sensitivity to me it means that you look at therapy from that person's lens and you fit it in for the person's need rather than try to put your approach to them.
Thank you for sharing that. So you have worked with diverse populations, including refugees, immigrants, and individuals facing serious mental health challenges. What have been some of the most rewarding or challenging aspects of this work for you?
Yeah, I can start with rewarding first.
Yeah.
I love the opportunity to work with communities that may not. I mean, most of my work included working with people who didn't speak the same language as me, came from a very different country, from a very different culture. Um, And I'm grateful to have had that opportunity as a student in the US, that you get to work with people from so many different countries, with an interpreter. And so the most rewarding part of that is, how do you actually translate your work to meet their needs? How do you understand them? Communication comes with language. Language has so many different expectations to and fro. So, I mean, you need to understand what's going on. And so I think that was a brilliant opportunity to do that. The most rewarding part of that, again, is the direct impact that you make. A lot of times when people have experienced significant amount of grief and trauma, especially trauma that comes from war, enduring war for so many years, losing family members, um, even when you're put in a safe place in a different country, here in the US, it's hard to move on from all the trauma that you carry. And but I think in the process of therapy, I do a lot of grief and trauma work. We talk about, not, you probably can't let go or forget the people you lost, on your way here. There might be survivor's guilt, that you survived but your sibling did not, or your sibling is still in war experiencing that threat right now. However, in therapy you can help them know that this is not, i- you know grief is always going to be a part of your life, but it doesn't have to be your entire life. It could be a part of your life, and you could take care of yourself in a way that you're prepared for the future when you have to support other family members. And so your life is not over. You have to live, and you can still live a more meaningful life despite having lost so many people. Um, and to be able to see that, it's almost like, symbolically, I would think of how people carry so many, like a bag of stones. Each trauma is like a stone, and carrying that bag and walking uphill for a long period of time can get very exhausting to you. And I think therapy helps you, like, look at each of the stone and examine them, process them, and then bury them where you are, and not have to carry that weight on your shoulders for the rest of your life. So I think that, to be able to see that, and to be able to see a person smile back, someone who's not smiled for a really long time, or to be able to help them look at life more differently than what life has been for them, and to them, can be very rewarding. Obviously, the challenge is, vicarious trauma. It's traumatizing. Sometimes you come home and you can't forget it. You can't let go of that, right? You're still thinking about what's going on in their minds. And if they're worried about a child who's stuck somewhere where there's no contact, through internet, phone, you'd find, I mean, I found myself Googling, I'm like, what's going on in this country, or what's happening? And that was just, it's sometimes hard to keep that balance, to keep that work life balance. And so have started doing, I mean, a lot of rituals. I have a lot of support here in my program, my supervisors, advisors, classrooms, to help do that. But I would say that we're humans, and so the trauma that impacts them also sort of sometimes impacts you. And so it's important to be able to distinguish the two.
That is very important. Can I just say, I really loved your analogy of like trauma and grief and how we carry those with stones, and the idea of burying each individual stone as we come across
Mhm.
that thought and that specific, I guess, thing that had happened. Because I think grief and trauma specifically are things that we kind of don't talk about enough.
Yeah.
And trying to get someone to talk about it and open up and, I guess, go, I guess, just trying to figure it out, is hard.
Yeah.
And a lot of times, sometimes there is that expectation of just forget it. Like everything will be okay. You don't have to think about it. But at the end of the day, they're thinking about it. It's there. It's very much real. And so I really loved hearing your explanation on
Yeah.
that. So thank you
Thank
for that.
Thank you. That also reminds me, though, of like the cultural sensitivity piece. Our culture in general, be it from any country, the general culture is, we need to be productive, we need to move on, we need to be happy. If you're a mom, you have to care for your other children. How could you be depressed and sit at home? How could you be traumatized? You don't have time for that. And so the expectation is you keep going without, but again, I like using analogies. It's like a wound, right? If you've got a wound on your leg, and you could ignore it, just move on with your day, but if you don't clean it up, it's going to rot, and it's
Mhm.
going to still hurt, and it's going to get worse. Therapy is like opening up that wound, cleaning it every time you meet, and then putting a bandage over it, and then, but you, over a period of time, it heals. And with grief, some people might be worried, if I talk about grief, if I process it, if I talk about death, I'm bringing bad luck upon myself. It could be so many different beliefs that would prevent people from coming and seeing a therapist. And I think our job as a therapist is to understand what is their religion, what is their background, why do they think this way, and acknowledging that, because those are barriers that could be preventing someone from, I mean, and most of our even physiological disorders now, doctors are saying a lot of them are lifestyle related, like heart problems, including some people say cancer, is related to your lifestyle related. And so I do think cultural sensitivity would allow people to bring themselves in and to address, firstly address what's stopping them from coming in. It's also common with men. I worked a lot with shelter house, and these are like middle-aged white men who've always been taught you can't share your emotions, you have to be a man up, and you can't talk about your pain. And I think it's just, that's, it's important to acknowledge and let go of those stones, bury them, give them a good goodbye, but
Yeah.
you can't carry them all your life.
So within your work, how do you help your patients or those that you work with foster self-worth and self-compassion?
Yeah. Thanks. I like self-worth. I like one of my favorite. I have lots of favorite psychologists. I have 100, I think. But one of them is Carl Rogers, and he spoke about conditions of worth, which means he said human beings tend to have, from a very young age, they're told you need to fulfill these conditions to be able to feel worthy. And if you don't fulfill those, and this is reinforced everywhere, right? Like if you're going to school, if you don't get a certain grade, you're not worthy. If you don't succeed in life in a certain way, if you don't do things that you're supposed to be doing, you're not worthy. And so he said these conditions of worth really prevent us from feeling a sense of self-worth. And one way to foster self-worth is through unconditional positive regard, which means you show positive regards for a person, you respect someone for just being a person. You don't need to fulfill any conditions, just learning to love and accept yourself. Another psychologist spoke about the, loving someone for being, not for doing, right? And so, um, helping my, whoever I work with see that conditions of worth are what society and social expectations put on us. Um, and being able to know that it's okay, all we are all products of our context. If you you were faced with a certain situation and a certain, your choices, your thoughts, your lifestyle, everything you do is context related. And so I really help them look at the context of their behavior. It's easy to blame yourself and be like, oh, I was stupid to do this, oh, I shouldn't have done this. But if you go back and look at the context, you realize you did your best. You couldn't have done better than best. And so I think I help them with that context. And for self compassion, again, Christine Neff is a pioneer in self compassion, and she spoke a lot about moving away from self esteem, which is an estimation of yourself. And she said, self compassion involves kindness, common humanity, and mindfulness, knowing you're not the only one. Everybody makes mistake. You're one of many other people. Um, and being kind to yourself. It's okay to make a mistake. It's okay to say something that you shouldn't have. And if you did it, it's fine to forgive yourself. And so I think self compassion, again, and self worth are both very important for our mental and physical health and relationships.
Thank you for sharing that. So my next question here are, what are some common mental health challenges that you see people are facing, and how can they be addressed effectively?
Um, I think, I mean, the most common mental health, I would say concerns that, three or four, I would say, is anxiety,
Mm.
depression. Adjustment disorder is also pretty common when you go through a new life adjustment phase. Like currently, I'm working with cancer patients, and getting a new diagnosis. You've had lived your life a certain way, and all of a sudden you have this diagnosis that you're living with, you're working with chemotherapy, that could be an adjustment. And post-traumatic stress disorder is also something, I mean, given the exposure I've had in my work with refugees, immigrants, homeless, in the homeless shelter, and it's just, it's a lot of trauma that comes from either being directly exposed to something traumatic, or knowing someone who was directly witnessing something like that. So vicariously, you're getting that trauma. Yeah, so we do have a range of other disorders like OCD, and those things show up. But I think I would say these four, at least in my work, have been the most common.
And for that second part of the question, how do you think they can be addressed effectively? Or what have you seen, I guess, is the most effective within your experiences?
Yeah, I believe every, like, a lot of therapists have their own styles of working. And so some people look at the cause of problems to be irrational thinking or cognitive distortions. For some other, it's more about childhood experiences. Everything stems from that. My approach is more with what's called the acceptance and commitment therapy, which looks at a lot of things like values. They believe that if you're far away from your values, living a life that you truly value, doing things that you value. For example, if someone is really values a meaningful relationship but has had bad experiences in the past, and because of that now just chooses to avoid relationships or is very avoidant or distant, that could cause distress. And so addressing what that is, and rather than trying to change your thoughts about anxiety, you learn to accept it, that I have this anxiety and yet I'm going to try to get into a new relationship. And trying some of those things. It also has mindfulness as a component, which is living in the moment, being present, acknowledging what's going on. So it's a lot of you know addressing what's going on. But I'm more eclectic. I also address childhood concerns. I think sometimes that is very relevant, your past. And if that's something like someone was told in their childhood that you're not capable enough, what if they're carrying that even today? And so talking about things like that to me is important. And I believe flexibility, learning to be more psychologically flexible, what acceptance and commitment therapy says is allowing yourself to feel those feelings and then process it to be able to move forward. I don't It's like cleaning up the wound. You
Mhm.
have to open those wounds up, and you need to do that with a lot of self compassion. If you're very judgmental towards yourself, it's hard. And as a therapist, then I think it's my job to offer it to them, to offer a space of acceptance and openness and flexibility to the patients, so that they are able to see that for themselves, and let go. If someone feels anxious and is engaging in anxious behaviors, and if they're very irritated about it or angry at themselves, that's not going to help us solve the problem. So we look at it with more openness and with acceptance and try to see what is the function of this anxiety, where does this come from, what's the context of it, and then be able to move past it. I don't know if that gives, but yeah,
Yeah.
if that gives an example. But I'd be happy to share more if you have any questions.
Well, my next question here is just with someone that has experience in counseling psychology specifically in both the United States and in India, what changes would you like to see in the mental health system over the next decade, we'll say?
Yeah, thanks. I do feel, I mean, systemically in the mental health system, I feel like we need to have stronger gatekeepers of who qualifies and how we are checking for qualifications in therapy. We really need ethical, not just ethically strong, but morally strong therapists who have a personal commitment. Some people say you don't need to be a good person to be a good therapist. I do think that you therapy room require, you are a person in there. You're not working with machines. You're working with people.
Mhm.
And so being a person is very important. But in terms of access, also, again, with psychology and psychologists, our field has been a lot contained in academia. George Miller used to say it's time to take psychology to the masses. And I think we need to do more of that. But systemically, we don't have a lot of structures built in to be able to, because we want to make sure that we're within the ethical route. We don't want to do therapy on TV because that's not the full version of what therapy is. But we want to create awareness about mental health. There are so many people from rural areas who say, oh, well, we watched a TV show and then we realize therapy is not that bad, right? And so I do think exposing, because if we don't do it, there are people ready to do it on TikTok who don't know anything about therapy. So as a field, we need to take it to the masses, and we need to do. I think it's very expensive to be in therapy. It's a privilege. It's a huge privilege. I think mental health is a basic human right. It should not be. It should be more available. I wish that we had other policies like that would make mental health care a lot. I think it would make a better society. We had mental health care more accessible. Our society would, there would be so much impact in so many areas. My hope is you'd see impact on, communal harmony. You'd see impact in crime rates. You'd see, because people need some support. We're human beings. We have so many complex emotions that we deal with. So I wish that the access was more. We trained more people. There were more incentives for therapists, because therapists are burnt out. They don't have, you know, enough time. There's a thing called compassion fatigue. And so if we had more therapists, we had more access, we had more support for therapists who are getting burnt out, it would be much, much better. We need a lot of therapists right now in society.
I agree. What advice would you have, or do you have, for aspiring psychologists or community leaders who want to make an impact in mental health advocacy?
Yeah. I would say the first thing that has been important to me is be a part of the community you serve. The farther away we are from our education, I mean, being a student, not having a lot of money, maybe you still have some closeness with, but the farther away we get, I think, from our society and people we serve, we don't necessarily see or realize what their pain is. And it doesn't have to be, you don't have to get involved in the client's life, but you can be involved in your community, be part of community events. Iowa City is so brilliant. We have so many dinners, we have so many community events that happen, even those festivals that happen in the summer. They give you exposure to interact with people from and you don't have to be from the community that you serve. You could just be interacting or be part of it rather than just be completely academically removed. I think we're not I don't know a lot about engineering, but I would say it's not the same as engineering, right? We're not engineers, we're not more working with machines. We're working in the community that we wish to serve. And a common feedback that I've heard from clients is, at least the people that I've worked with, is that they feel more validated and heard if we are understanding what's going on, and if we truly get it, what it means to be in this society and to experience what's happening to them currently, contextually. And to do that, you have to be involved personally, on a personal level. And other than that, I would just say we have an ethical, but I think also moral obligation to people, to everybody. Today, even a person who doesn't have a lot of money, when they buy food from McDonald's, they pay taxes. Those taxes contribute to my education and everybody's education, and higher, is getting a PhD. I think we have a direct responsibility for people who can't afford therapy to advocate for them, and to make sure that we reach them if they're not able to reach us, in whatever ways we can.
Thank you for sharing that.
Yeah.
So, with us kind of coming to an end, where can the viewers or listeners find you? Like, where's the best place to contact you? And if you want to
Yeah,
share.
thanks. I have my, I'm at the University of Iowa. So that's the easiest. I have an email there. I'll be happy to answer questions. If I can be of help to any student who is aspiring to be a psychologist, has any questions, I'll be very happy to address that. I also have a LinkedIn, although I'm not, not necessarily always active as a PhD student on social media. Sometimes I just take breaks for months. So I would say email, and I'll be happy to share my email with you as well. Um, to reach out to me. But you could try to message me on LinkedIn or something. But email is just better.
Okay. Well, thank you so much for joining us today on the podcast. And of course, thank you everyone for listening to the My City, My Health podcast.
Thank you. Thank you for this opportunity.